of the influenza vaccine MIPS measure 110. This is a telehealth eligible measure. The definition is patients 6 months and older who are seen between October 1st and March 31st who have received their annual flu vaccine. The flu vaccine period is between August 1st and March 31st. Live attenuated flu vaccine is excluded from this measure. The workflow is as follows. You want to check for flu immunization status in immunization and therapeutic injection at the top of the screen. This is the only place you're going to want to look for and document any immunization information in ECW. Up here we see a vaccination that was given on December 8th, 2021. So as far as this patient's concerned, this measure has been met. If I did not see a flu vaccine in here, but I saw over here in their public health record that their influenza vaccine had been given somewhere else and was recorded here, using this little blue arrow, I can move this into the patient's record. Now, when you do this, oftentimes you're given a lengthy list of vaccinations. Oftentimes you're going to only see one that is active, and if you don't and you do not understand which one the patient was given, you can opt for historical vaccine and it will move it into the patient's chart. It is perfectly acceptable to use the patient's historical report for a flu vaccine if they've got it somewhere and it's not recorded in the public health record or in our vaccination account. Verbally, you're going to need to enter it into the patient's chart. Again, you're going to want to do that under immunizations and therapeutic injections, the only place in the chart where you should be putting injection information. I'm going to select Add. And because this is information of a vaccine given in the past, the first thing I'm going to do is select Yes for vaccination given in the past. I'll search for our flu shot list. The patient did not know which vaccine she received, so I'm going to select Historical. I'll put the date that the patient got the vaccine. Or roughly therein. And I'm going to select OK. Now the vaccine has been put into the patient's immunization record in their ECW chart. The exclusions for this measure are as follows. Any patient who refuses, cannot get due to an allergy or intolerance the vaccine, or the vaccine is not available to the patient. You can do this most easily over in the clinical quality worksheet. So we'll click on the red pending. Find immunization management, and here you'll see influenza vaccine not administered reason. By clicking on the exclusion option here, you can pull up whichever reason is the most appropriate. Please remember you never use no reason specified. So I'm putting in patient reason because this year the patient refused her flu vaccine, and this will exclude the patient from this measure. Thank you for your attention.